I would like to share with you what it is like to go through the process of healing from an amputation. Whether by trauma or illness, it's estimated that 1 out of every 200 people in the United States has experienced the loss of a limb. Even though the experience is difficult, there is hope through the healing journey. Artificial limbs help amputee patients regain the functionality and use of a missing limb. With so many resources available to us today, you can return to an active life. I'm Dr. Wendy Nelson, and as a physician, I know what my patients need medically, and as an amputee, I know what it takes to get back out on a limb. Everyone experiences a sense of loss after losing a limb. It takes time to heal, and things are going to be different. But there is hope. The process is different for everyone, but most people begin their experience with amputation in the hospital, and often on a rehabilitation unit.
My career started with the Sheriff's Department about 22 years ago. At age 45, I was one of the oldest deputies to complete SWAT training with the San Bernardino County Sheriff's Department. Most of us in law enforcement, especially deputies, have to do our detention time. And each and every one of us gets sick because you go in the jail and there's so much of airborne things that are there that we don't know what they are. When I got sent to Victor Valley Jail up in the high desert, within 2 weeks I started getting flu-like symptoms. After taking over-the-counter medications for over 2.5 months, it didn't go away. According to my son, I told him, take me to urgent care, I'm not feeling too good. They rushed me into ICU, ER, ICU. The pneumonia had gotten so bad during that period of time that it had gotten into my bloodstream. My heart stopped 17 times, and I had 6 heart attacks. And the pneumonia turned into sepsis. Sepsis is what affected my extremities, my legs, my hands, and the doctors had no choice but to do amputation in order to save my life.
I just got off work and got on the back of a friend's motorcycle. And driving around downtown Riverside, we were stopped at a stop sign on an empty residential street, maybe 3-4 blocks from my apartment. And just noticing a black SUV coming towards us, losing control at a high rate of speed, and so the back end swung and hit me. My leg was broken literally from mid-thigh all the way down. So every part was just shattered. And so they fused it and left it like in a 45-degree angle. And so I couldn't take care of myself, and it basically came down to, do I walk and be independent, or do I keep my leg and be able to wiggle my toes and need some assistance when walking? And it was easy. Had my left leg amputated above the knee, and just kind of started my life after the leg was gone.
Most amputees begin their journey in inpatient rehabilitation, which is about a 2 to 3 week hospital visit. Inpatient rehab is designed to help you through the healing process so that first, your wound is healed, stable, and strong enough to begin the next phase of care.
After the surgeon has done the surgery and the patient has lost their limb, it's a seamless transition over to inpatient rehab. Over in inpatient rehab, we have an interdisciplinary team that works together to improve the patient's function. There is the physician, the rehab physician, 24-hour nursing, physical therapy, occupational therapy, as well as the psychologist. When a patient goes through a limb loss, their whole body image changes. And when that happens, we're here to support them 100% of the way. And through our psychologist, through our peer visits, through the physicians, and through the entire staff, on every step of the way, we're there to support them.
Physically, it means a loss of a limb. They're not going to be the same person now. They wonder whether they're going to walk again. And the psychological trauma is overwhelming.
My ex-wife was there at that time. She came over. She basically said that I had lost both my legs. They had amputated both my legs below the knee. So I said, okay. So I don't have legs. All right, I can live with this. But she stopped and then she said, but that's not it. And I go, what else? She said, well, you lost your left arm and all your fingers on your right hand. That was a shock. I didn't have any words. I didn't know what to say. How does anybody react when somebody tells you just lost both your legs and all your fingers? I cried. She tried to console me, to make me understand, and obviously that wasn't going anywhere. At the end of the day, I had to focus on my loved ones. And my children are everything to me. And so I had to change my thought process and be looking at positive rather than the negative.
Once everything that hurt was cut off, it was like a weight was lifted. I wasn't dragging around a limb that didn't work. I was an active person, but before I lost my leg, before the accident, I did what I wanted, I went where I wanted, and there was no question about could I do anything, and I wanted that back again.
After inpatient rehab, you will work with another team of professionals in the outpatient therapy setting. This team is made up of physical therapists and a prosthetist, and they're going to help you to learn how to use your new prosthetic or artificial limbs.
What our job in outpatient rehab is to get that patient back into their everyday life. So when we're looking at their quality of skills is getting in and out of bed, heading to the kitchen, walking to the bathroom. At the same time, they need to be able to prepare their stump, make sure that it's at the right size and shape to fit into their prosthesis. We look at strengthening because we want them to return to their everyday life activities, return to what they really like to do.
As an orthoprosthetist, our job is to design and fabricate, engineer and fit a prosthetic limb or orthopedic device to meet a person's needs who has a physical disability or mobility challenge or needs assistance with activities of daily living. And we customize each of those devices to fit the individual for their specific needs and to address their specific concerns.
And then once we get that prosthesis, that's a foreign object that's being placed on that extremity, and now we have to get used to the weight of that, and it's not really part of us yet. It does become part of you, so that is a challenge psychologically as well as physically.
It's not very easy to use prosthetics. You're not going to learn it overnight. So the biggest thing is for you to exercise, to work on your core, and do everything that your physical therapist asks you to do to strengthen your core. Every amputee is different. There is no one amputee that's the same. So every amputee has to learn their strengths and weaknesses, and when they've done that, then they have to continue with their prosthetics and keep using them.
What is so important is if you tell your therapist what your goals are. What are your goals in therapy? What does it mean to you? What do you really want to do?
We sort of want to help set realistic goals, but at the same time, we don't want to do barriers and pretend like something's impossible when in fact it could be if we all agree that that's important and we should do it. And that's our job as the orthoprosthetist, is to support the patient in achieving whatever those goals are.
I was a runner prior to my accident, and I just ran for stress relief and for fun, and that was just my thing, and I haven't run in 3 years. And I can feel when I'm at the gym and I'm walking on the treadmill, I can feel I'm ready to run. My body wants that.
Somebody who loses their legs can still walk. It's just a matter of teaching your brain to recondition to the new ways of doing things.
Another step in my recovery is now physically being able to get the exercise I need and to go out and show that you don't need 2 legs to run.
Our end goal at outpatient rehab for physical therapy is for them to return back to all of their daily activities and all of their life skills. The person that they were supposed to be and that they are, that they return back to that.
It's very important for the patients to understand that every member of the team is there for them. The reason why we're here, the reason why we have prosthetists, therapists and nurses and surgeons and other rehabilitation physicians is to help the patient through the process. That's why we're here. We're here to serve.
Everyone faces challenges in their lives that they have to overcome. Surviving an amputation and learning to use a prosthetic limb is like climbing a mountain. You have a visible, overwhelming disability that has changed your life. The peak seems insurmountable. The enormity of the climb seems impossible. But just remember, the rehab process is the path that will take you over the mountain. A dedicated team of multidisciplinary professionals will be with you to help you reach the summit so that once there, you know there is hope beyond healing.
Life can be awesome. Just being able to breathe and get up in the morning, that's what life is about. To wake up and see another day, you are blessed.
I did feel like I wasn't going to be able to go back to work. Like my adult responsibility part of life was over. But now I'm able to not only go to school, but I work at night also. I teach medical assisting. 3 days a week, I'm here in class.
I'm just as capable with a prosthetic leg or with 2 regular legs. Internally, I'm different. I'm happier. I think I'm a stronger person. I think I'm braver. I value things better.
I'm still very much part of the San Bernardino County Sheriff's Department and have been for 22 years. I go there a couple of times a month. If somebody has a question on a case and needs me to kind of guide them through it, then I do it. So life can be normal. A lot of people think with amputees, life is not normal. Well, they're wrong. We don't want sympathy. We want people to understand that this is our life. It's just different now. It's not abnormal. It's not unusual. It's just different. Do not get distracted by the negative things of your life. Always be positive. Don't give up. That probably is the key. Don't give up. No matter what happens, you don't give up.